We want to once again turn to and welcome back Dr. Stephen Thomas, Chief of Infectious Disease at Upstate University Hospital. Thank you so much, Dr. Thomas, for joining us again tonight.
Thanks for having me.
Another day, more consistent deaths in Onondaga County. If you could please put into perspective, where are we at in this battle against the coronavirus in Central New York? Are we in a better place since the last time we talked? It was probably about a week ago?
Yeah, so there are some signals that we're seeing some positive trends, and those positive trends are in terms of the number of new infections that we're seeing on a daily basis. And those positive trends are directly related to people adhering to the social and physical distancing policies that, that the county and that the state have asked people to comply with. On the other hand, we are still seeing a number of cases each day, 20 to 30 new cases per day. We are continuing to see people succumb to this disease and die. So I think what it represents really is sort of the fragile balance that we're in that if we really strictly adhere to the physical distancing and the hygiene policies of washing hands, coughing into our sleeve, washing hands, physical distancing, that we can move in a positive direction. But if there's any let up in this area too soon, then we could be back to where we were before.
Oh boy, I hope people are listening to you. Let's move on to this topic because everybody's talking about this. Researchers releasing some good news about a possible treatment for coronavirus. Evidence that the experimental drug remdesivir could help patients recover more quickly from the infection. So is this a home run?
Not a home run, but certainly very encouraging. And so this is a drug that is, the design of the drug is to interfere with the virus replicating. And so that's kind of how it works. The data that has been coming out that was mentioned by Dr. Fauci and others, it's preliminary data, but there were definitely some positive signals in that it reduced the duration of illness for a certain subset of patients. So I'm optimistic, but I'm cautiously optimistic, and I am measured in my optimism because we still don't have the complete data set. The data has not been through peer review. So these are objective folks that are not involved in the trial have to look at how the trial was done and what the results look like. But it certainly is encouraging that they saw some clinical benefit in that subgroup of patients. But we have to wait for what the final tally looks like before we can label it a home run.
All right. Now, so many of us are grappling with this. Once the green light is given, how to move forward. Restaurants and stores starting to get ready to let customers back inside. What would businesses need to do to keep this virus at bay as we look ahead?
Yeah, so the first thing that we should do is we should listen to our local Department of Health, our county Department of Health, and we should listen to our state Department of Health. They're going to have the most up-to-date guidance on the rules that are going to apply to any businesses that are open. The second thing is that folks are really going to need to continue to maintain discipline in terms of the physical distancing and the hygiene policies and guidelines that are out there. And you're going to have to figure out how to apply those to the particular industry or work environment that you have. So for example, let's say you have a restaurant that has 30 tables that are 3 feet from one another. You may have to remove 2/3 of those tables to ensure that you can maintain a certain distance from patrons being a certain distance from one another. Your staff may have to, because they're not going to be able to maintain physical distancing in the kitchen or in other areas, for example, then you may need a universal masking policy within your workplace. So the guidance from New York State Department of Health, the guidance from the County Department of Health, and then you figuring out how to apply those within your own workspace.
All right, and I know schools, parents so anxious, teachers looking forward to the day schools reopen. What can you say as far as that and how we might envision what school would look like? What would back to school look like for us?
Right. Yeah. So I think the first point is that we may not go back to school during this school year, and I think people need to understand that is one potential option. And again, I would look to our county and I would look to the state for that decision. If they are given a green light, I think a lot of what I just mentioned for the workplace environment is going to apply to the school environment. And so anything that we can do in school to kind of chip away at the risk of people transmitting infection between one another, I think that those are things that need to be considered. So big mass assemblies, probably not a good idea. Cafeteria, packing a lot of kids and people into a cafeteria, that's probably not a good idea. So our educators are going to need to be innovative in terms of how they try to apply public health interventions within the school environment. But I have kids that are in school, and I'm very encouraged and optimistic that our educators in Central New York are going to be able to kind of figure out what a happy medium will be. Because again, we have to remember, because I hear a lot about this, it is true kids can get infected, and kids may not get as sick as other people do, certainly not as much as adults, but they can still transmit the virus, and when they come home, they can still bring the virus to people who are at greater risk. So it's not just about the kids, it's about the people that they live with, and so we got to think of the whole family unit in this scenario.
Right. No assemblies, lunch in the classroom, things are going to look a lot different. Dr. Thomas, we so appreciate your guidance. Thank you so much, and thanks for all you're doing in helping our community through this difficult time.
Thank you very much.